Hello everyone, my name is Mickey McDaniel. I'm a student with the University of Texas at Arlington College of Nursing. Today I'm here to provide you a video on Socratic questioning. The overall purpose of this video is to demonstrate how an educator would use Socratic questioning as a teaching strategy in the classroom environment. Some of the major outcomes that will be accomplished after watching this video should be: identify the use of Socratic questioning in a classroom teaching environment. Also, number two, to evaluate the effectiveness of Socratic questioning in promoting an individual's ability to actively and critically think. The third thing would also be identify at least 3 advantages that are associated with the use of Socratic questioning in a teaching environment. To begin, I would like to state what Socratic questioning is. Socratic questioning is the ability of an educator to provide probing questions to the students or an individual in order to analyze their individual thinking skills. And according to Brown and Bannigan and Gill in 2009, Socratic questioning is a teaching method that actually promotes their ability to perform these skills, and also to add on the critical thinking or critical questioning abilities. The specific topic that we're going to address in this video, as will be demonstrated through the interaction between me as the educator and 2 other students participating in it, is we're going to be in regards to congestive heart failure. So at this time, I would like to introduce the 2 students that I have participating. I would like to begin by introducing the 2 students over here, and I will go in and I would like to say your names for the video.
Christine and Melissa.
Okay, Christine and Melissa, thank you so much for coming in. As you know, in previous days' classroom setting, we were talking about congestive heart failure, or how the heart pumps itself, and then we went into the difference between left and right heart failure. You remember that when we were talking about the left side of the heart, that it actually pumps the blood into the systemic circulation? And I point down because it's kind of easy to see circulation, arterial flow down and vascular up. And also the right-sided part of the heart, it actually pumps the blood back through the pulmonary circulation, and it allows oxygen to be trapped into the blood that's going to be circulated to vital organs and other parts of the body. So according to that, and having that concept taught to you, have there been any situations that you've been able to apply what you've learned in the classroom into a clinical situation?
Well, I actually, last week in clinicals, took care of a man that had heart failure, and it was left-sided heart failure. And he had shortness of breath and diminished lung sounds, and that totally makes sense now, because when the left side of the heart pumps blood to the systemic circulation down, in your legs and your vital organs, but it's receiving it from the lungs. So if it's not able to pump out to the systemic, it's going to back up in the lungs. So totally makes sense with shortness of breath and decreased lung sound.
Well, when you talk, actually, I had something kind of like that. I had a patient with right-sided heart failure, and that means it's going to end up backing up into the system down there. And he had really bad edema and swollen ankles and leg edema. So that makes sense too. If it was backing up, it wasn't getting the blood up into the lungs and stuff. So that makes sense as well.
Those are 2 great examples, and as you can see, how you used your classroom concepts to promote the active and critical thinking skills into the clinical environment. That was excellent. So, based on that, since you're both nursing students, and pretty soon you're going to be graduating as new graduates and soon be nurses. So and I want you to use your thinking skills to tell me, what is the plan of care? Like, if you were their nurse, what does the actual plan of care consist of for a heart failure patient?
Well, I think the doctor would probably want to put them on diuretics to get that extra fluid off of their system.
And my patient was actually on Lasix, so that must have been why the patient was getting Lasix, was because of the heart failure, and I think they were trying to decrease the edema and the backup into in their legs and ankles and stuff. We had to have their legs propped up on pillows.
My guy was on that too. Yeah, to help pull some of that extra fluid out.
That's
Great.
very cool.
So what are some of the other additional stuff? The Lasix is the number 1 thing you're going to think about pulling fluid. If it's in the body, either in the lungs or in the systemic area, or actually not in the vascular space. It's going to go into their tissue. You're going to see the swelling, or you're going to, as you said, it goes into the lung. It's building there. So what are kind of some signs and symptoms that you to refresh everyone's memory, what is some of the signs and symptoms for left-sided heart failure when you said it backs back up into the lung?
Well, my guy was short of breath, and he had diminished lung sound, so he had maybe pulmonary edema, maybe some crackles. He might also have some of that red frothy sputum.
Right,
My guy didn't have that, but I think you mentioned that last time in class.
Well, I know my patient, though, was on daily weights because they said something about weight gain over a couple pounds actually is a symptom. So we had to weigh them every day and monitor their eyes and nose really close to find out if the fluid was where it was supposed to be, and if the medications were working.
So those are great examples. Now, most doctors may forget to put on the order to kind of help the nurse to remember, their roles in taking care of a heart failure patient. Can you think of anything else that maybe a doctor could forget that is very important that a nurse would use their critical thinking and active thinking skills to perform daily duties with the patient or taking care of the patient?
Actually, we admitted a patient that day too, and they didn't write the diet down. And I know that for those patients, because the fluid is such a big deal, they had to be on the low sodium, the heart healthy low sodium diets and stuff. So we had to make sure that they were getting the right food and didn't get too much salt intake. And we were watching their potassium and sodium levels.
Right.
So,
And
great
speaking of
example.
potassium and sodium levels, we need to make sure that we're doing labs. So we want to do, BMP to get the potassium, and then my guy had a BNP.
So it's the BNP and the BMP to make sure that we're checking the potassium and sodium and checking to see how bad their CHF
Is it getting better or is it getting worse?
So if you're on Lasix, what kidney does it affect? Or what organ does it affect?
It affects both kidneys.
Right.
But if for the kidneys, we want to make sure we're checking their creatinine and their BUNs and stuff to make sure that it's not hurting their kidneys while we're treating the heart failure.
And we want to make sure they've got potassium on board too.
Exactly, I remember that.
Very good. I am so glad that I can actually see how Socratic questioning can help you apply the knowledge that you learn in the classroom setting to the clinical environment. Thank you so much.
Thank you.
So we're going to move on to kind of what are the advantages associated with Socratic questioning in a teaching environment. According to Billings and Hofstede in 2012, number one, as it was demonstrated in the video, it promoted active and critical thinking. It allowed them to question stuff. There's interaction between me, the faculty, and the students that you see. It actually applies the classroom concepts to the clinical area, in which they were able to demonstrate that in the video. And number one, the major thing here is that it stimulates them developing higher level questioning skills. And the final thing is there are no wrong answers. Everything should be counted as correct. So now I would like to end this video by acknowledging the references and some of the literature that I use throughout. And I would like to thank you for all of your time and allow me to provide you a video on Socratic questioning.